Okay, so this is, what is this? This is the Human Services Committee. It's January 13th at 9-ish AM. I am gonna hand this over to
Sarah.
Yeah, Sarah from Department of Social Services. I was trying to remember the Department of Social Services part. I knew Sarah.
All right, good morning, everyone. Just have a few things on the agenda for today for DSS. The first one is to amend our Crossroads case management contract resolution. We plan on amending it to decrease from 3 case managers to 2 for the year. And the contract will also change to only serving Crossroads, the case managers, not the motels.
Okay. Is there a motion?
So moved.
Second.
Any questions? Okay, move to a vote.
Martini,
Aye.
Bazile,
Yes.
Brockway,
Yes.
Mendez,
Yes.
Clapperton, absent.
Hearing no no's or abstentions, the motion passes.
Okay, the second request is the resolution request to extend for 1 year a contract with Empowerment for Families Counseling Services. We've completed the 3 years. We're just requesting a year extension with that.
Is there a motion?
So move.
Sorry.
Any questions? All right, move to a roll call vote.
Martini,
Aye.
Bazile,
Yes.
Brockway,
Yes.
Mendez,
Yes.
Clapperton, absent.
Hearing no no's or abstentions, the motion passes.
Okay, we have a couple requests to create, fund, and fill a temporary caseworker position for 6 months. We actually have 2 of those. Create, fund, and fill 2 temporary caseworker positions.
Is there a motion?
So moved. Second.
Question, APS stands for Adult Protective Services.
That is correct.
Any other questions? All right, move to a roll call vote.
Martini,
Aye.
Bazile,
Yes.
Brockway,
Yes.
Mendez,
Yes.
Clapperton, absent.
For personnel service, we have hired 10 new staff, 4 caseworkers, promotion to a senior caseworker, a clerk, social welfare examiner, account clerk typist, and an employment training assistant. We have also unfortunately have 7 vacancies in different positions. For housing, our stats for the month for the motels and the shelters, we currently have 6 families in the OFO shelter. We are using 7 rooms at Motel 88. We are using 18 rooms at Crossroads with 20 individuals in those rooms. Genies, we are using 4 rooms. Agency housing currently has 6, with 2 more to be filled in the next couple of days. And Super 8 Motel, we have 1 room being used. And we have to.
Is that a new addition?
Yeah.
It is. We need to work on finding hotels that are ADA disability compliant.
Oh, okay.
So we are working on that as we speak, actually. So for OPD stats, there was 11 calls for the month, 10 of those calls for DSS individuals.
Individuals or?
10 of those calls were for DS individuals. A few of them were a couple of individuals that are no longer at Motel 88, but the past month had quite a few calls amongst the 2 of them.
Seems like we moved that around.
Needed some help. So
Okay,
that was it.
great.
Think we are done for DSS.
Oh, cool. That was quick.
You like it? All right, thank you.
Thank you.
Have a good day.
You too.
See you guys.
Oh, there's sure.
Are you all set for me already?
Yeah.
Okay. All right, so Heidi just gave me a few updates. So far this year, we have had 646 flu cases, compared to last year where we had 136.
Oh my gosh.
Yeah. And then our COVID, since October, we've had 108 cases. And in the same time period last year, we had 209. So those were the updates she wanted to give to you.
And is it too late to get your flu shot?
No, you
Okay.
can give us a call if you need to. So,
I would
okay.
strongly
So
suggest-
first thing, oh, I'm sorry, go ahead.
I was going to suggest today, if you haven't got your flu shot,
What'd you say, Nora?
I'm going today
to Walgreens, so. I'm done so. I mean, I don't have any there. I should.
all right, now Cheryl, sorry.
That's
Yeah.
okay. That's okay. So the first thing we have is the Children with Special Health Care Needs grant has come up for renewal for the time period of October 1st of 2025 to September 30th of 2030. We receive $58,813 per year. So the total of the grant is $294,065. So we'd like approval to continue with that grant.
So
I'll make that
moved.
motion.
Up
I'm sorry.
second.
Any questions? Move to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Pepperton absent.
Okay. The motion passes.
Okay. The next thing is we just would like approval so that we are able to purchase our vaccines for 2026 through our blanket POs that we do, not to exceed 19,000 for the year.
Is there a motion?
So moved. Second.
Any questions? All right, move to a vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez,
Yes.
Pepperton absent.
Hearing no no's or abstentions, the motion passes.
Okay, thank you. And two, we would also like approval to continue with our preschool support program that we have with McGinnis. That allows us to do our claiming to the state and to Medicaid for the reimbursement of preschool services. And that should not exceed 16,000 for the year.
Is there a motion?
So moved.
Second.
Any questions? Move to a vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez,
Yes.
Pepperton absent.
Good. Hearing no no's or abstentions, the motion passes.
Also approval to continue our support for our electronic medical records with the Patagonia program. And that is from December 28th of 25 through December 27th of 26. And that's a total of $13,848.52.
Is
And
there a motion?
that's,
Oh, go ahead.
I was just gonna say, that's the electronic health record that we bill for the immunizations and those types of things.
Okay.
Uh-oh.
It's been doing that. Is there a motion?
So moved. Second.
Move to a vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Hearing no no's or abstentions, the motion passes.
Okay, the next thing is just to have approval so we can pay the 2026 MySacho dues in the amount of $3,753.54.
So moved. Second.
Any questions? Okay, move to a vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Okay, hearing no no's or abstentions, the motion passes.
Okay, thank you. And then the last thing we have is we are requesting approval for two people to attend the Society for Public Health Education Conference in Portland, Oregon in April from the 20th to the 24th. The cost shouldn't be more than $4,500, which is fully grant funded. And we have also been asked to present at the conference concerning the GIS program and how it's relating to our public health.
Is there a motion?
Yeah, so moved.
Second.
Any questions? Move to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Motion passes. Are there any other questions? Comments? Things we should know? Go get your flu shot.
Yeah, get your flu shot, yes. Stay home if you don't feel well.
All good advice. Okay, well,
All right, thank you very much.
so Jeanette isn't due yet, about 9:30.
I saw Jeanette sitting in the parking lot, but I don't have her cell number.
I can text her.
Sure.
Sure.
And one thing I wanted to bring up. Last year, the year before last, all the years blur together. We started the opioid task force to spend the money that the board had got. Through the opioid settlements. The task force, Michelle Caton was on the task force, and I'm looking for another board member to join. So, yes,
love to, yeah.
you volunteer as a tribute?
I do.
Okay.
What did I just do?
Yes,
Yeah.
God help you.
yes. No. So we meet infrequently.
God help you and thank you.
Yes, yes. Both things can be true. So what we're doing is the county itself versus the community services. So the county itself was awarded a certain pot of money from the opioid lawsuits.
Right.
Last year we had a task force we put together, put out an RFP, and then awarded money to 3 organizations that are doing opioid. I mean, abatement is the wrong word, but in the county, we still have money. We would like to do another RFP round. I just don't want to be the only voice from the
No,
county. So, okay. All right, I'll circle back and loop you into the meeting. Yeah, I realized as we started to have the next meeting, I was like, oh no. Didn't put all that together till just now. We will do. But Jeanette, oh great. Morning.
Morning.
We're ahead of the game, so yeah.
I was gonna take a nap in the car. I'm glad I did.
Well, if you want to go 15 minutes right now.
I have to do executive session. I was hoping to do first because I have Penny bringing me something to bring to the committee and
Okay.
she's not quite here yet.
Okay. Did you text her?
Yeah, yes.
Okay, to let her know that we're speeding ahead. Why don't we go ahead and move into executive session, and that way when she gets here, we can just hit the ground running. So, is there a motion to move into executive session?
So move.
Second.
Second.
Oh, for reasons?
Yes, I was just gonna
Sorry,
say, you
sorry,
need
sorry,
to read the
sorry.
reasons.
I'm like,
Not on my A game this morning. It's F, I believe. The medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. Yeah.
There may be another reason, perhaps having to do with litigation. I'm talking about the Medicaid thing.
No,
I don't know. We were gonna talk about that here, right? Just a heads up, or
I can give a heads up.
okay. So,
As far as I know, no details have been made, just off of our meeting, I can tell them what that was.
So, yes, if you could also go in for that reason.
so we are also going in for reason D, discussions regarding proposed pending or current litigation. Yeah. Inviting in We invited Denise, the county treasurer. Jeanette, Steve. That's probably,
Ellen should probably be here for the litigation.
okay, and Ellen Barnes, Penny when she gets here.
It's okay.
Sorry. I didn't, no, she didn't need to be, Penny doesn't need to be
right, welcome back. We are coming out of executive session. Handing off to.
Thank you. I'd like to start and ask the board for a waiver, not to do an RFP to, contract with a psychiatrist for the mental health clinic.
So moved.
Second.
Any questions? Right, move to a roll call vote.
Martini.
Aye.
Bazil.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Okay, hearing no nos or abstentions, the motion passes.
And I'd like permission to contract with a psychiatrist at no more than 260 hours per year at $300 per hour, which would be a total no more than 78,000 per year.
So moved.
Second.
Any questions? Right, move to a roll call vote.
Martini.
Aye.
Bazil.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes.
I'd like to unfill two positions. One is our billing specialist position and one is our addiction counselor position.
You're unfunded.
Unfunded.
Is there a motion?
So moved.
Second.
Any questions? Move to a roll call vote.
Martini.
Aye.
Bazil.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Okay, hearing no nos or abstentions, the motion passes.
And with that, I would like permission to fund and fill the advanced credential alcohol substance abuse counselor position
And the date on that,
effective January 1st, 2026.
any, okay, thank you, yep. There's a second? Okay. Clapperton second. Any questions? All right, move to a roll call vote.
Martini.
Aye.
Bazil.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes.
And they have approval to pay criminal actions in the amount of $49,272.30. And that is for the dates of November 1st, 2025 through November 30th, 2025.
This is a 25 cost.
It is.
It will likely, on the specific line, will be negative. And we will sort that out, when we do the true up, when Alan Ruffles does the true up in, I don't know, April or May, once, we've sorted all that out.
And it won't be negative yet, Steve. The public defender transferred in $100,000, so that is still in there that Jeanette has access to at this point in time.
Oh,
We may
great.
yet go negative with the December invoice, but for November, we're good.
Jeanette, do you have a sense for the December invoice yet?
I don't, I put out calls and they haven't been able to tell me, 'cause I think this was our last person in. And he's been returned, so sometimes they get in without coming from my department, so, I just have to wait.
Okay, all right. Okay, well,
Do we have a motion in a second? No. Is there a motion?
So moved.
Second.
Move to a roll call vote.
Martini.
Aye.
Bazil.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Okay, hearing no nos or extensions, the motion passes. There seems to be a conversation in both sides.
It's not related to this, but I would like to modify something that we did, the motion.
Oh, okay. So the approval of pay criminal action that passed. Now we need to go back.
The CASAC position, the credential position that we just spoke about, that would be create, fund and fill. I believe it might have been worded fund and fill, but that position will be created and fund and fill. And it will go through, board resolution will go to admin next week or the week after, and then to the board. Create, fund and fill.
Is that what it says?
I don't
Oh,
have
okay.
anything on that.
Okay.
So I will make sure it's on that.
Cool.
The last thing I had put out an RFP in the fall for opiate funds that go through my department. I had 4 responses. One, I've taken them to the CSB board. One we approved, quickly because they would like to get started in March. It's a school. So I'd like approval to grant Lawrence Central School $13,999 from our opiate funds.
Is there a
I'll
motion?
make that motion.
Second.
Any questions? Move to a vote.
Martini.
Aye.
Bazil,
Aye.
Brockway,
Aye.
Mendez,
Yes.
Clackerton.
Yes.
Hearing no no's or abstentions, the motion passes. Good, perfect. Any other questions for, Director Pavlis? Alright, we're good.
Okay, thank you.
I think that's it for action by the board. Any other question? Alright, motion to adjourn,
So moved.
Second.
and we're adjourned.
Recording stopped.